Hi, my name is Joy Blend, and I am a BSN student at Walden University, and I am presenting my project today on obesity in Lexington County and what in the world is going on. Lexington is located in the middle of South Carolina, 2 hours from the mountains and 2 hours from the coast. It is a suburb of the state capital, Columbia, which is in Richland County, and where the University of South Carolina Fighting Gamecocks reside. Lexington County has a population of approximately 286,000 people with a median age of about close to 40 and a household income of close to 60,000. Specific numbers are there in the slide. Between 2015 and 2016, the population of Lexington County grew from about 281,000 to 286,000, and its household income also grew just a little bit, about $1,000. The population in Lexington County is about 75.3% white, 14.3% black, and 5.79% of Hispanic. Statistics that matter. The county statistics indicate that the obesity rate in 2016 was at almost 36%, inching up every year. And that comes directly from the state of South Carolina DHEC resources. Hypertension, cardiac disease, and diabetes follow close behind. Smoking, cancer, and mental health access also hit the radar for the country, but for the county, but not as high as the obesity rate. In 2015, the rate of the adult obesity in South Carolina was nearly 32%, which places South Carolina as the 13th worst state when it comes to the incidence of adult obesity. And obviously, if you have adults like that, that are ranging in that category, so are the children. And along with the overall rates of adult obesity, South Carolina has the 8th highest high school student obesity rate, with 16.3 of their high school students also being obese. And that also equates, those numbers are pretty much the same as at the state level. These statistics are disturbing because obesity is a chief cause of type 2 diabetes, cardiac disease, high blood pressure, and many other harmful health effects. These healthcare issues affect supply and demand for healthcare, physical exercise, and many other market segments, making the obesity epidemic an overarching problem in the state of South Carolina. With the rate of obesity has doubled over the past decade because of the built environment that promotes increased unhealthy food consumption and decreased physical activity with the community. And so we should reassess the zoning of fast food and marketing trends. The built environment refers to the places that we live, that we work, we learn, we worship, and we play, and that is created or modified by people. So in other words, wherever you live in your environment or the community or the population kind of decide on what goes on in their community. So as Lexington County people, we have elected to allow capitalism to take place, and there we have all of these options to eat. So what is causing obesity in South Carolina? So one of the projects that we did was a windshield survey, and the initial survey's purpose was to assess the number of fast food establishments related to the proximity of schools, gyms, and grocery stores. And at every major intersection, there was at least one fast food establishment, at least one, probably two. But if you look into the gas stations that offer food, fast food, hot dogs, or anything else you want to get when you go in there, donuts, all that kind of stuff, that would, most of them would be more than two, but at every single intersection, especially within the city limits. Let's see, in the South, we were always noted and noticed for having a church on every corner. Well, the same can now be said for having a fast food place or ability to eat on each corner. Not quite sure what that says about us here in the South, but that's happening here. So the hypothesis that I came up with was, is it the fast food that is causing it, or anything else, maybe the lack of exercise? Well, it appears that the residents are eating out more than they are utilizing the gyms and outdoor recreation areas if you look at the overall obesity rate. Lexington needs sidewalks that are safe, so that encourages more exercise. They're currently installing more on the main thoroughfares, but still not as many in the more residential areas. And there I posted some pictures with all of that. So which is it? And this is kind of where my project led me down. What was the research? Looked at the research of what has happened in other counties and locales in the state and as well nationwide and even globally as well. What has worked? Well, the local food environment can constrain the success of nutrition promotion efforts. In other words, we can talk about nutrition all we want, but if we offer all these other and nice fun foods, which are we going to really go eat? Efforts to decrease the local availability of unhealthy foods, as well as programs to help consumers identify strategies for obtaining healthy meals at fast food outlets, may improve nutrition outcomes. So if you go to, if we look at some communities around the world as well, have put in effect zoning laws that have, in effect say you can only have fast food this close to this, or this and that and the other. And then, advertise that you don't have to get a cheeseburger. You don't have to get a fried chicken sandwich. You can get a salad. You can get a chicken salad. You can get fruit. You can do different things there at most establishments that are fast food. And especially the more the more regular chains that we're familiar with. Also, exercise is medicine, and many experts consider physical inactivity to be the major public health problem of our time. And if you walk down any street or you're driving in your car, where are the billboards that talk about exercise? What I see are billboards about stomach stapling, obviously the fast food signs, and you'll get those big gym, billboards, but not a whole lot in, encouraging people to get out, because a lot of the population can't afford the gym membership. So what do we do with that? How do we reach those people? Also, physicians have a responsibility to assess physical activity habits in their patients and inform them of the risk of being inactive and provide appropriate exercise advice. I've been doing this many years. I've gone with family members to physician appointments. My family is no different than anybody else's in most aspects. And I will tell you that very few doctors, other than getting the weight that the nurses get or the medical assistant gets before the patient sees the physician, there's no discussion on weight with the physician, with the patient, where there are many times that if the physician would actually sit down with the patient and discuss the weight issue and saying, we can help with your blood pressure right now while we're working on decreasing your weight, so you don't have to be on this blood pressure medicine, maybe, or your cardiovascular disease. Just how about your mental health? Doctors cannot allow, it might hurt their feelings. Well, is it going to hurt their feelings, or the family when they die of these things that could have been prevented? So it will take everyone in the community to step forward and be willing to change. And physicians can have a huge impact on the patient population with such attention given to the obesity and inactivity problem in Lexington. So what's next? So if we go to the physical education teachers in the middle schools, then we create a program for them to, whether we write a grant or come up and strategize with another program to have children be able to record their activity level as well as their food, then we can look at that 9 months down the road, as long as we have those good record keeping, and then we could see if we have any impact at all. We may have a complete wash, we don't know, but we've got to put it in front of people. We have to put it in front of patients. We have to put it in front of the children, and we have to put it in front of parents, because we're all in it together, and we need to address the issue. So that is it for my PowerPoint. I'm open to questions and discussions. If you have anything that we need to talk about, I'm glad to do so, but I really appreciate y'all taking the time and looking at this and seeing if there needs to be anything added as we go further along with our project. Thank you.